Good morning or good afternoon, depending on where you are. This is Heidi Notario. I'm the Vice President of Strategic Partnerships and Systems Change with the National Resource Center on Domestic Violence. And I'm very glad to have you all here joining us from all corners of the country, it seems, for our new special topic series presentation on coordinated entry assessment. So today is a coordinated entry decision tree, putting it into practice. And this is a follow-up to a previous presentation on the topic. So we'll get a chance to go deeper today, but also hear from practitioners. I'm here with Cris Sullivan from MSU, Research Consortium on Gender-Based Violence, Kris Billhardt with the National Alliance for Safe Housing, Lisa Kaufman from HUD, the SNAP's office at HUD, and Abby Miller, also from HUD, the SNAP's office. And in terms of the community practitioners and statewide practitioners, we have Leah Aromin from the Coalition Ending Gender-Based Violence in King County, Seattle, Catherine Juan Jara from Clark County Social Services, and Sarah Prout-Rennie from the Michigan Coalition to End Domestic and Sexual Violence. So warm welcome to all the panelists today. And a little bit of who we are. This is a webinar that is presented by the Domestic Violence and Housing Technical Assistance Consortium, which is a collaboration among several federal agencies and technical assistance providers. So this is work coming from all of us to you. And I wanted to also provide a little bit of context about this presentation today. So the consortium was set to develop a new assessment as part of the coordinated entry process for survivors of domestic and sexual violence to determine prioritization. So we were really looking to create an alternative to the widely used tool, the VISPDAT. And in our process, we determined that replicating a process where survivors' lives were reduced to forms, checkboxes, and scores would still fall short, inaccurately reflecting the intricacies of their situations and relative vulnerabilities. We also acknowledge that survivors' needs are diverse, complex, and intersecting, and simply applying a different score-based tool would negate all that we know about trauma and survivor-defined advocacy. Because these dynamics and barriers are even more complex for survivors that are Black, Indigenous, people of color, it is really important that we actively work to eliminate processes and systems which exacerbate racial disparities and other forms of oppression. So what are we proposing is an alternate approach. And instead of creating another scoring tool, the consortium is advocating that communities adopt a process-based tool to determine vulnerability and housing services. So one of those proposals was presented at the last webinar, and it was a paper authored by Dr. Sullivan and Lopez Cerron, titled Assessing for and Appropriately Responding to the Housing Needs of Domestic and Sexual Violence Survivors, a decision tree, as an alternative to a score sheet, and we'll hear more about that today. And in addition to that paper, we are releasing a few others. We already posted Assessing Vulnerability, Prioritizing Risk, the Limitations of the VISPDAT for Survivors of Domestic and Sexual Violence by Dr. Heather McCauley. The Importance of a Constellation of Housing Options for Survivors, and that paper will be authored by Kris Billhardt, and she will get to share some pieces of that today. The Cycle of Housing Insecurity, that paper was already posted, developed by Dr. Shanti Kulkarni, and she had the opportunity of presenting on that at the end of last month. And in January, we will release The Pitfalls of Prioritization, Consideration of Power and Culture by Dr. Nkiru Naulesi and Latoya Young. So a bit more on the context and why it's so important that we're looking at racial disparities in the context of assessing vulnerabilities and prioritizing survivors. You have some data in front of you from the NISBE's report that really highlight the tremendous presence of Native women in the context of housing as survivors of violence, intimate partner violence and sexual violence, as well as Black individuals. And we also know, and this is a more recent study by Dr. Shanti Kulkarni in collaboration with a consortium that really looked at how COVID is impacting survivors. We know that survivors of color and the proportion and the impact of COVID is vast and disproportionate for survivors of color. We know that the death rate of Blacks is 1.5 times higher than their population, the rest of the population. We know that there have been several attempts at erasing Native Americans from some of the data by classifying them as other. And we know that research is already suggesting racial residential segregation as a fundamental cause of health disparities. And that's part of our COVID survey. And then here on this slide, I'm showing you what many survivors are reporting, and many of these statistics are specific to survivors of gender-based violence. They are included in these groups. And again, the disproportionate rates among survivors that are identified as Black, Indigenous, people of color. With that, I'm gonna pause and we're gonna share with you an animated infographic that highlights racial disparities in the context of housing insecurity and gender-based violence.
Homelessness is an issue that far too many people face. People of color, specifically Black people, other persons of color, and Indigenous people, experience homelessness in a dramatically different way than their white counterparts. People who hold multiple identities, such as those who live at the intersections of disability, immigration status, sexual orientation, gender identity, and more, experience compounded barriers that further homelessness and housing instability. A recent study found that 66% of people experiencing homelessness were Black, while 28% were white. Black individuals are only 13% of the US general population, compared to 74% of those who are white. Rates of homelessness within Native communities are 3 to 8 times higher than that of the general population. In total, 78% of people experiencing homelessness identified as people of color. This overrepresentation of Indigenous, Black, and other people of color experiencing homelessness cannot be explained by poverty or identity alone. Structural racism, historical policies, institutional practices, and cultural narratives that perpetuate racial inequity put people of color at a disadvantage in obtaining safe and affordable housing. Statistically, women of color are much more likely to experience domestic and sexual violence, and survivors often face network impoverishment. Network impoverishment occurs when the addition of a financially distressed household member places an extra strain on family resources. Oftentimes, we tell a survivor experiencing homelessness to go to a relative or friend's house. However, network impoverishment can cause immense burdens on the existing limited finances and available support from that network. Racial disparities arise at every juncture, from the legal system, to housing, to healthcare, to child welfare, to public benefits. Understanding the intersections between domestic and sexual violence, racism, and homelessness, and applying an equity, survivor-centered lens in our work is the only pathway to stability, safe housing, and healing for all survivors. If we want to address racial inequity, we have to acknowledge it, learn about it, and talk about it so we can do more about it together. To learn more, visit safehousingpartnerships.org.
And with that, I'm going to turn it over to Dr. Cris Sullivan to take us into what it is that we are proposing as an alternative.
Thank you, Heidi. I really appreciate being here today. I'm glad to see all of this interest. I want to just tell you that what I'm talking about today is going to be a very, very brief summary of what we talked about in the first webinar. because you can get that white paper and you can also get a transcript to the prior webinar, I believe through safehousingpartnerships.org. But I just wanted to set the stage, go back a little bit and explain why we have been doing this project. So if I can get this to move forward. There it is. Okay, so just as a brief introduction. So as most of you know on this call, HUD requires that COCs utilize a coordinated entry system because there are so many homeless people needing housing that we need to prioritize people who are in the most need and the most vulnerable. And the system is intended to make sure that people are being fair and that folks who need housing have equal access to it. So the idea behind this is a good one. It was to make sure that, we didn't just prioritize people that we liked or people who were easy to work with. We wanted to make sure that there wasn't favoritism or prejudice and that this process was fair and equal. While the idea was good, we know now, having done this for a while, that communities still continue to struggle with doing this in a way that is equitable and fair. So it's an ongoing issue that we're dealing with. And the most frequently used screening tool that people are using right now is the VI-SPDAT or one of its iterations. So I want to just quickly talk about some of the critiques of the VI-SPDAT. And primarily it was created to assess vulnerabilities of chronically homeless individuals, primarily who are experiencing severe mental illness and or substance abuse. So it does not work well for other groups of homeless individuals and families. We've now got empirical studies that show that it lacks validity and reliability, and it also may result in racial bias. And we have these links here for you to go to if you want to find out more about that. So people want to move away from the VI-SPDAT. Most people don't like using the VI-SPDAT, but we don't have a great alternative. People want something that's brief and easy to use and that's reliable. So they want something really easy that's going to quickly and reliably rank people's vulnerabilities, document their preferences, and link them to the correct housing resource. Unfortunately, overly simple solutions, though, aren't often the answers to complicated problems. And we know that this is a very complicated problem. So as Heidi mentioned at the beginning, we spent a lot of time trying to figure out what to do about this. And we propose that instead of having a tool that gives people numbers, it sort of tries to reduce complicated lives into numbers that then we compare people against each other, that we help people through a tool have brief but focused conversations. Now here, if you're reading along, you'll see that we're talking about survivors, and this is a project of the Domestic Violence Resource Centers. The Housing Consortium deals with domestic and sexual violence. I want to be really clear that we realized early on, we don't want to create something that is just for domestic and sexual violence survivors. What we're hearing from people is that would not be as useful. It's not as helpful. We need to have one tool that we can generalize across populations. So that's one of the things we're going to be talking about today and hearing from the panelists. So even though this tool was originally created thinking about the safety and housing needs of domestic violence and sexual assault survivors, I want us to keep in mind how we can generalize this, because we know that all homeless folks have had trauma in their lives. They almost all are dealing with safety issues, either within their homes or within their communities or by the state. So we do want this to be something that's generalizable, but this is a process that we're going through, and that's why we're very excited to have you all on board today, and hopefully we can have some really thoughtful discussion on how to move this forward. So we created this decision tree that involves asking pretty pointed questions about a number of the following issues. The first, and again, in part because this was created for domestic and sexual violence survivors, but I think this would be true for a lot of homeless individuals, is to assess safety. I want to back up for a second and say some people, when they're assessing domestic violence survivors' needs, are using Jackie Campbell's danger assessment tool. There's a lot of reasons not to use that tool to help link somebody to housing, though. It's a great tool to understand severity and lethality risk factors. But how severely someone's being abused or what their risk is around abuse does not directly translate into then what's the housing that they need. For example, as you see here, if we have a domestic violence survivor who is currently housed, but they are in extreme danger, so they are about to become homeless if something doesn't happen, one of the questions to ask is, could you stay in your home? Do you want to stay in your home if we could offer various safety precautions and financial help to do that? We know in many areas, losing your home is going to, keep you homeless for a long time because there just is so few housing stock available. So if we can keep people in their homes, we need to do that. And they may be in severe danger, but there may still be ways to safely help them stay in their homes. So safety, so asking questions around where could you live that you would be safer? What are your concerns? Where wouldn't you be safe? Having questions around safety, and then questions about recent housing stability. Because we know that if somebody has been stably housed for a long time and now they're dealing with one crisis, that if we can just help with that crisis, they will no longer be homeless. That's going to mean we need different resources and different skills than somebody who's been chronically homeless for years and maybe has no employment, severe trauma going on, all kinds of issues that need to be dealt with. So talking to people about how long have you been homeless? What have the issues been? What are the barriers that you're facing now to being housed in the community? And then it's also important to ask people what they want and what would be acceptable to them. So this isn't an assessment that then results in us telling people what they're going to get. We know from many, many different fields that if you assign somebody to receive something they do not want, they will not feel heard, they will not accept it, or they will not stay. So we need to make sure this is a conversation, find out with the person what's going to be the best fit for them, while also being realistic about what actually exists in the community. So this decision tree may look very small on your screen. Again, it's just to let you know that we have this decision tree. It's a work in process, like everything at this point. You can get it through the Safe Housing Partnerships website, which is also where that fabulous video is housed. That you all saw today. But I want to just briefly go through this. And again, this was set up for domestic and sexual violence survivors, but a lot of it could be just, modified a little bit, because a lot of it would make sense for a lot of homeless people. First, asking if the person is housing stable. And if they are, you see the green boxes to the left. If they're not housing unstable, and that's true for many domestic and sexual violence survivors, then they go off this decision tree. You provide the appropriate supports, information, and advocacy that they would need. But you'll notice it ends with saying, but continue to assess housing needs, because housing needs change, as we know, and they can change in a heartbeat. So we don't want to assume that what the situation is today is what the situation will be tomorrow. But let's go over to the rest of the tree. If the answer is no, so the person is not stably housed, then we'd want to find out if they were in imminent danger or not imminent danger, because obviously if they're in imminent danger, they may need shelter or something very similar to that. It would indicate they're in crisis. And when somebody's in crisis, that's not the time to sit and have a very long conversation. The idea is get them safe, get them somewhere where they can stay calm and feel secure and safe. And then within 24 to 72 hours, have more of that conversation. Once they're not in imminent danger, then the rest of this flow chart you'll see in blue, by asking questions around safety, stability, and barriers, we can start to get an idea of what might be the best response to that person. And again, I don't have time to go into all of this in detail. We go into it in more detail in the white paper, but just to quickly go through, if the person has been stable and they're just experiencing a one-time crisis, then they may just need some flexible funding. They may need brief advocacy. And if that's all they need and all they want, they're not looking to go into a shelter for 6 months or transitional housing. Let's make sure that we're allocating resources in a way that's really smart and will go as far as possible while also meeting people's needs. So we've got that population of homeless survivors. We also have some folks that by the answers to your questions, you may find out they've been fairly housing stable. They probably just need 3 to 6 months or so of assistance. And so that might shift you toward rapid rehousing or briefer advocacy, flexible funding and advocacy. So, again, you'd want to be talking with them about what would keep you from being able to be housed in your own place. What are your safety issues, trauma issues, et cetera. We're also going to have a group of people who need maybe longer than 6 months up to about 24 months. They may need transitional housing, longer term financial support, housing voucher, advocacy services. And then we have to remember, even though we often talk about people needing up to 24 months of services, the reality is some people are going to need even longer than that. Somebody who's dealing with severe trauma, intergenerational trauma, immigration issues that may be preventing them from even getting a job until their immigration process is finalized. There is going to be a small group of people that's going to need longer than 24 months of attention and resources. And if we don't give them those resources, they will simply just stay in this system for a very, very long time. So it may seem like a lot of resources right now, but if it's done correctly and they become safely and stably housed, they won't continue to need our resources. So again, this is a starting point. We created this decision tool. We did a webinar to see if people were even interested in it before we got into it any more deeply. In our last webinar, there was a lot of excitement and interest in using this or something like it, which told us, let's go into this in more detail. Let's bring in people from around the country who are doing something similar to this or something that is an alternative to the VI-SPDAT that they think is working better. And so that's where we are today. And so I'm going to turn it now over to Kris Billhardt to take the next session.
Thanks so much, Kris with a C. I am with the National Alliance for Safe Housing. And I think, Brittany, we were going to have you shifting the slides at this point. Yes, thank you. And I just want to say that it's been so exciting to be part of this conversation and to see the energy that's going on around it, both as a technical assistance provider who regularly connects with programs and communities who are wrestling with these issues, but also as a longtime victim services advocate and provider in my previous life, where we wrangled with it directly and saw its implications to survivors' lives and their welfare kind of on a daily basis. So transforming our coordinated entry systems to increase survivors' access to housing options is the title of the paper that will be coming out soon. And I'm going to just be touching very lightly on some of the topics that it explores. Kris kind of already gave a little bit of a preview about that. So when resources are scarce, as Kris was referring to earlier, as they are in our nation's housing resources, it's kind of like a game of musical chairs. Because there are more people than spaces, we have to create strategies that allow us to find the people most in need of a seat, so to speak. But every day in our housing and victim services systems, we greet people with really complex intersecting issues, and their experiences with racism and trauma and a variety of hardships have taken an immeasurable toll. And then we try to measure that toll and put a number on it. And the current push towards transforming our coordinated entry processes and tools, the tools, but also the processes surrounding them. It's a necessary reckoning with where we're falling short, not just for survivors, but for everybody. And so, again, most of the shifts that we're in conversation about right now address racial equity, and to better address the needs of survivors, we believe are good shifts for everybody. Next slide, please. So survivors need all the options. When it comes to how survivors are faring in coordinated entry assessment processes, we see certain patterns across many communities. And one of the primary patterns we see is that survivors who come in seeking housing help are often routed directly to shelter. That's kind of the default response. And sometimes, as Kris was saying, that's a very good call. But sometimes they're really seeking something else or needing something else. Their specific vulnerabilities might get missed. It's really, really hard to talk about intimate trauma in particular with a stranger. So how that connection gets made with the person is really, really important, and how trust is established. A conversational approach is much more likely with the training for the assessor in the back pocket. Much more likely to allow you to depart from a checklist of questions and establish that trust and safety. Survivors have experienced lots of damage with systems, so they may be distrustful to begin with, and then again, those complex and intersecting challenges are really hard to capture and quantify. Next, please. So survivors face particular kinds of danger and harm, but they really do need the same range of options that others facing homelessness might need. Balanced attention to the safety and support needs that make a survivor's circumstances unique, and what they have in common with others in need of housing help really makes it clear that all options need to be on the table. So it might be about establishing safety and addressing immediate crisis, but it may actually, where shelter or hotel vouchering or safe homes or other things to make a plan to get safe and begin addressing the crisis is important. But it may be different. It might be, I've been in a shelter. I didn't get where I wanted to go from there. I really want to tackle some of my barriers and not be in a temporary place again this time. And then there's the group that are really looking at embedding the safety and having lasting stabilization. And it might look a number of different ways, as Kris was saying, from establishing a safe shared housing somewhere, or it could be permanent supportive housing. And that's in particular one kind of housing that survivors are pretty rarely connected with because of different prioritization in communities. Okay, next slide. So why is this conversation happening now? I think it's three intersecting factors that portend a perfect storm, so-called perfect storm, and we really have all three right now in the meta environment that we find ourselves in. We see in data that those disproportionately impacted populations are continuing to be disproportionately impacted, and failing to change that and move the needle on that really asks us to look at how racial bias could be baked into our established systems and tools, as we were talking about earlier around systemic racism. COVID is a second pillar in this perfect storm. It's disparate impact on some of the same disproportionately impacted populations among people experiencing homelessness, really amplified the equity concerns. And then the urgency of COVID and getting people into housing where they could be safe from the pandemic exposure necessitated, among a lot of systems, moving away from waiting lists and crowded shelters and towards figuring out how can we expedite this and how can we get people more quickly into housing and make those connections directly. And then the third aspect is the growing recognition of trauma. As we've been saying, it's not just domestic and sexual violence and human trafficking survivors that are coming into our systems with high levels of trauma. And so a trauma-informed and individualized approach that really recognizes those complex realities is really part of the zeitgeist right now and part of what's motivating this look into revisioning coordinated entry. So when we look at the next slide, some of the emerging community strategies, and you're going to be hearing from our panelists a little bit later today who are enacting some of these strategies. We really wanted to be able to put out there, this is not just theoretical, many communities are entering into these conversations and putting some new strategies into action. Some of what we're seeing when we do that scan across the nation is that communities are doing things like modifying how the VI-SPDAT is used, maybe not moving away from it entirely, but adding pieces to it or modifying when and how it's used, so it becomes part of their strategy rather than kind of what they solely rely on. They're also developing community tailored assessment tools, building their own tools that better reflect what they have identified as the community priorities and needs. They're also incorporating training, and I mentioned trauma, training in trauma, and becoming more informed about trauma-informed approaches is a big piece of it, so that the assessors are better equipped to have those conversations and establish relationships with folks who come in with all those complex issues and really see people. Adopting conversation-based assessment, as we've been talking about, and then really exploring ways to deepen partnership with not only victim services providers, but culturally specific communities and programs and people with lived experience. So that's a really essential element to this conversation right now. Okay, and I am going to turn it over, I believe now, to the SNAPS folks. Oh, we're moving into the panel. I'm so sorry. Okay. So we'll hear from SNAPS after the panel. Okay, well, we have, as I said, we've been seeking out community examples of the different efforts that different jurisdictions and the strategies that people are enacting, the conversations that they're having, what they're looking like, where they're ending up in terms of implementation. And so we've got three communities who are going to be sharing with us today what's going on in their neck of the woods. And you can see them listed here today. We probably don't have nearly as much time as we'd like to have for this conversation, but we're going to dive in and see how far we can get today. So panelists, before we have you each describe what your transformed coordinated entry process looks like, I'd like to ask about what motivated the change, what problems you wanted to address. And let's start with you, Leah. You're going to tell us about the parallel domestic violence coordinated entry process that you're developing in the Seattle-King County area. What made the Coalition Ending Gender-Based Violence decide to move in that direction? What problems were you trying to solve?
Sure. And hello, everybody. Thanks for having me here. This is really exciting to be part of this. Can folks hear me? Okay. Yeah. So the key changes that we're about to implement, because we haven't implemented them yet, are 5 years in the making, I would say. So I have a sort of two-part answer to this. For here in King County, coordinated entry was implemented back in 2012. And in 2015, the DV community was approved for a waiver to step out of the system and establish our own. So we stepped out of the mainstream system back in 2015, specifically because we very quickly realized that it was not serving survivors well. The assessment and prioritization tools didn't account for really the complexities of domestic violence and the immediate and long-term safety and housing needs. So what this meant was that domestic violence transitional housing programs had empty units for months and months, even though there were families in DV shelter or being served in DV community programs that were waiting to access, longer term housing. We also found that survivors who didn't need culturally specific services were being placed in culturally specific transitional housing programs. And so that was sort of taking up limited space that was designed to meet the needs of immigrant, refugee, and deaf survivors specifically. And then we also found that folks who clearly didn't want or need housing with DV supportive services were getting placed in DV housing, while others who just desperately wanted to be in DV housing were not getting that kind of housing. So sort of first step, we moved out of that mainstream system and we established our own in 2015. So for the last 5 years, we built and maintained our own system, and it had to be pretty simple because we had no staffing or funding for that. And so what we came up with was a coordinated referral system that was centered around a common application tool that all DV housing providers used, a standard process for posting openings, and some loose prioritization guidelines that each agency had, but there wasn't any formal oversight or structure about how to implement that, and then some monthly meetings to continue coordination and like continuous improvement. Leaving the mainstream system solved some of the problems, but now that we had to create our own due to lack of capacity and amongst other things, we ran into other issues all centered around consistency, transparency, and equity. So the common application that we were using and that we're still using right now was found to not be a particularly useful document because it didn't provide enough information for adequate prioritization. And so organizations were using different tools to supplement it to get more information. Prioritization was certainly happening, and programs were doing their best to prioritize the most marginalized, but there was no consistency, oversight, accountability, and sort of how that was happening. So essentially, once the common application was submitted, each agency had a different process for what the next steps were. And then from a community standpoint, there wasn't formalized training on the common application, what its purpose was, how this information was used. So it was a mystery, or it still is a mystery to community providers, how DV housing providers actually prioritized survivors they referred. Also, who could access DV housing programs or resources were not very clear. Notifications were going out to gender-based violence providers in the county, but again, there was a lot of lack of clarity in that. So in 2018, we got DV bonus funds to finally have someone do the coordination and connection work to build on the approach that we currently had set up and to address those gaps that I just described. And that's where I come in. In 2019, I was hired to work on addressing the issues that I just mentioned. And I think that was a very long
Great,
answer,
great.
Kris. I apologize.
No, thanks, Leah. And you did get in a little bit to describing what you're doing, but we'll come back to you to get a little bit more of a clear idea of how it's working for you. Catherine, let's move to you. You're here with the perspective of a COC lead. What were you noticing in Clark County, Nevada, that catalyzed the change process?
We started coordinated entry implementation probably roughly about 6 years ago. And that started off with a pilot of about a couple of years focusing on our population, which is our largest homeless subpopulation of adults without children. And at that time, we also, like many communities, implemented the VI-SPDAT as our assessment tool. And we had our Clark County social service sites, which we have multiple sites throughout our region, mostly throughout the city of Las Vegas, Henderson, and unincorporated Clark County. We have 5 different sites, so they became the assessment sites at the time. So what we noticed primarily is with the assessment tool itself is that it wasn't being able to capture some of the primary issues that we were noticing in our homeless subpopulation or our homeless population in our community. So some issues were not rising to the top, so to speak, as far as things that we would consider primary factors in vulnerability. And one thing we did particularly notice as we were working with our domestic violence population is that some of the things that are being captured in the VI-SPDAT do not directly talk about the vulnerability of folks that are experiencing domestic violence. So a lot of folks in our community that were coming to us from a domestic violence background, we're noticing that they're not going to have the long history of someone that's chronically homeless. They weren't going to have maybe necessarily mental health, already diagnosed mental health issues or other health issues that also factor into chronicity. So what happened after those first couple of years of implementing coordinated entry, we created our own tool, which is called our community housing assessment tool. And then when we later brought on additional subpopulations into coordinated entry, which we did at the same time about 3 years ago, we implemented coordinated entry for youth, families, and domestic violence subpopulations. What we did was we worked with all those groups to determine what is the best method for and what is the best kind of tools and questions we wanted to incorporate for coordinated entry. So when we brought on those additional subpopulations, we created a family version of our chat. The youth's working group decided to move forward with using a VI-SPDAT tool, which is the next step tool. And from domestic violence, we kind of took a different perspective on it because we realized we didn't want to recreate a system that was already working. So for example, currently, and continuing on, our domestic violence partners are the experts at what they're doing and what they're assessing and the kind of things that they need to see as far as the crisis that's occurring in a household to be able to determine what's the next step and what services are needed for that household. So we continue to let them do that work. But the way we were able to determine how to get to that place is we actually created a triage tool. So even before we go into a coordinated entry assessment, we created a very brief triage tool of about less than 7 questions that determines right at that moment what is the dominant need. So if someone needs shelter, if someone is experiencing a medical issue and needs maybe emergent medical care, are they experiencing domestic violence? So do they need somewhere to stay that night? And are they having issues with perhaps law enforcement? And do they have does that something that needs to be dealt with immediately? So we created that triage tool, which is used universally across all of the populations to be able to determine a couple of things. What's the next step? So do we immediately move on to a coordinated entry assessment? And that triage tool also helps determine the subpopulation that household fits into. And then that also then helps to predict what assessment tool they should do, because we do have an assessment tool, again, like I mentioned, for each of the populations. So that let us be able to create steps and a decision tree as well to determine like, okay, if someone is experiencing domestic violence, they've gone to maybe not a domestic violence provider, they're able to take the next steps of referring them to a domestic violence provider to be able to be triaged for their services. And then on the back end, once someone has been more stabilized, whether they've been receiving shelter services or some other kind of services for their domestic violence situation, then our domestic violence providers will work with those households to determine what are now their housing stability factors to be able to be referred to a longer term housing situation. So do they have a support network? Do they have resources? Of course, are there specific areas geographically that they cannot go to? So does that predicate, looking at certain referral bases or referral sources for a housing placement, those kind of elements, because we wanted to make sure that we, again, were looking at the strengths of what's being presented by the household to be able to determine their stability, not just necessarily looking at only the vulnerabilities. We look at those together for the DV population. So those were kind of the things that we really looked at to make our community take some steps into turning and being more comprehensive in how we were doing coordinated entry. And the other part that we do that was very important is we do community-wide training on the assessment tools. So we do a no wrong door approach. So then every person who takes on the responsibility to become an assessing agency gets trained in all the tools. And during all of our trainings, we do have a portion in relation to domestic violence. So they can talk about what are some of the things you need to take into consideration. So like private areas, being able to, if, for example, a couple comes in, being able to safely separate people if that's what's required to be able to determine what's the next step and what's the next referral that may need to happen for a household or for an individual. So those are kind of all the things that we work very closely with a domestic violence subgroup in our planning processes, as well as subgroups for all of our subpopulations, and being able to determine how we wanted to move forward and create the policies and procedures for how we operate.
Wow, there's so many different channels that you have created to really address the complexities that come in, rather than just kind of having a monolithic response and everybody does X. You've really fanned out in a lot of different directions that try to accommodate all that complexity. Thanks, Catherine. I know we're getting a lot of questions and comments in the chat, and people are going to want to engage further with you and with Leah. Thanks. Sarah, let's move to you. As the ED of a state domestic and sexual violence coalition there in Michigan, what can you tell us about the why of your change effort and what you're doing to try to solve some of the problems that became evident to you?
So thank you, everyone. My name is Sarah Rennie. I'm the executive director of the Michigan Coalition. I'm also an attorney, and I started my work with homeless folks back in the late 1990s. And I think to do our work, we have to know where we've been. And I did work before the VI SPDAT, where there was a lot of implicit bias and explicit bias. So I don't see the VI SPDAT as a failure, but a step towards what we need to do for improvements to sort of capture the importance of trying to standardize how we're going to treat people with dignity and respect. So I was fortunate to be the chair of the VI SPDAT subcommittee of our Michigan Homeless Policy Council, and we are looking at things. I also, to back up a little bit, after I got done litigating, I ran a nonprofit that had both a physical DV shelter, a physical domestic violence shelter, as well as the HARA. And what I found is it made no sense to have trauma-informed care on one side and treating our homeless folks differently on the other. I also found that those of us in the DV movement don't always realize the amount of domestic violence and sexual assault folks are encountering in homelessness, because we're usually getting the most emergent cases. So what I really want to do is look at the ways that we have separated ourselves from the homeless movement, and instead of emphasizing the separation, figuring out ways that we can work together to make sure all of our care is trauma informed and based in the best practices of our field. So our subcommittee has agreed, and we that we're going to propose and hope to get training dollars to do what before we even move to a different tool from the VI SPDAT. It's not just the tool; it's the totality of who it is that's using the tool and the systems we're in. So we want to do significant training on the neurobiology of trauma, trauma-informed care, and implicit bias to all the homeless service providers and all the DV providers. So we're all starting out with a baseline. After that, we are also looking at all of the various iterations of both the VI SPDAT as well as the decision tree, and looking at ways that we're going to produce a white paper at the end of next year around which of these are good options or best options for Michigan. To do that, we're doing a survey of one of the first things we're doing is a survey of how this gets decentralized, or the devolution happens between the concepts behind the VI SPDAT, which for those of us who remember that were implemented were pretty excellent at the beginning, and how that gets devolved with staff turnover and how it becomes sort of a routinization of just scoring. For the VI SPDAT, a lot of the questions are themselves re-traumatizing, and if you don't know how to ask them, whether it's a decision tree or the VI SPDAT, they're going to always be re-traumatizing, because people are going to give you the answer they need to get housing. We also want to make sure that we're not excluding those folks who are chronically homeless. Many of them have traumatic backgrounds that started with domestic violence, and we can bring things from our field to chronic homelessness, as well as folks who have substance abuse problems. Really, this is an intersectional lens we look at for all folks who are experiencing either immediate or long-term homelessness. So my goal, and I've been really lucky to have some extraordinary folks in Michigan supporting that goal, is to look at putting together whatever tool we use that really emphasizes the individual needs and the intersectional identities of everyone seeking housing.
Wonderful. Thank you, Sarah. And you've all spoken to this to a certain degree, but I want to give you a chance to say a little bit more about your efforts, just kind of across the board, have all been very tied to the specific needs and the so-called the personality of your respective communities or states. So I'm wondering if you can share a little bit more about what the process you used was to craft your new system. How was it coordinated? Who was involved? What voices did you have engaged in that? How did you get the green light to go forward with this, either from your COC or as your COC, in your case, Catherine? And what kind of pushback did you get? What kind of challenges came along as you were implementing, or in Leah's case, planning to implement? So we can maybe swing back to you, Leah, if there's more you want to say about what your system is going to be looking like and what your process has been like to get there.
Sure. So I can talk about sort of 3 key changes for us. And one thing is that we're going to be able to connect and integrate with the new domestic violence centralized helpline, which is going to be a King County-wide helpline that collapses the current 24/7 DV helplines. We have 3 and the other smaller helplines into one kind of robustly staffed, well-resourced access point. So while this domestic violence central helpline isn't being developed just for DV coordinated entry, DV coordinated entry is going to benefit greatly from it, because it is this one big access point that we haven't had before. And other than the domestic violence coordinated entry resources, folks can also access shelter and flexible funds for diversion prevention through that access point. So that's one key change for us. The next thing, I talked about that common application just not working at all. So we have drafted a new joint application assessment in 3 parts that uses an open-ended sort of guided conversation model. And very briefly, it provides a space to capture how the household's experience of DV has led up to their current housing instability, while also gathering information for prioritization and using that same information to explore possible options like prevention and diversion. So that's a big ask for an assessment tool. And we have it down to 5 or 6 pages. And again, the goal is to capture as holistically as possible how domestic violence has impacted housing stability, including, and Sarah, you talked about this just now, how the intersectionalities of identity further impact their experience of housing instability. So in the tool itself and the training that service providers will receive on the tool, we tried to thread throughout sort of the understanding that folks causing harm often leverage systems of oppression as a manipulation and abuse tactic. The acknowledgement that systemic racism impacts folks' ability to get what they need to heal from trauma, and essentially that race matters and identity matters. And we really wanted to have an assessment that reflected that reality. So an example is, in asking, have you ever been denied a rental application? A prompt or follow-up around that is, have you experienced discrimination or unfair treatment in any parts of the rental process? Getting more specific. Some other highlights would be, instead of just asking what kind of support do you have in your community, framing it as, what does your community look like? What does support look like in your network? Again, with the acknowledgement that being in community can look all different things for folks. And it can be useful to take a pause and explore this concept of community and its impact on safety. So that's, in a nutshell, kind of that. And then we're also moving to like a 3-part prioritization process, and we've decided to prioritize in these 3 parts. And the first thing we're going to be asking is, which households are disproportionately impacted by domestic violence and homelessness? Looking at the data and continuing to ground ourselves in this as it may shift. So we've decided to just take a direct approach to that. The second piece is looking at, in 8 different categories, what the impacts of domestic violence has been for the household. How far is the household from the resources and options to get them more safe and stable? And we're going to score for that, including any type of scoring back into this process was hard to swallow for folks because but because it's just one part of the prioritization process, we decided to try it. And also scoring for DV impact, I know how that could sound. The recognition too that the true impact of DV is often invisible, intangible, can only manifest later on. And how do you really put a number to the complexity of someone's trauma? We absolutely understand that. And then the third piece is our cross-agency case conferencing process, where now that we've narrowed down sort of the number of households in the priority pool, there's going to be a case conferencing process with a mixed group of folks that we're going to be very intentional in bringing together. And it's going to be a robust facilitated discussion on barriers to safety and housing, a lot like what Cris Sullivan was talking about. And asking questions around, how can we make this resource work for the household rather than the other way around? If not this resource, then what other options? Again, threading throughout how systemic oppression has impacted this household's experience of domestic violence and homelessness. And lastly, what are the needs of the household that DV housing advocates are uniquely situated to support with? Framing a conversation around that. And I guess briefly, the other question you had, should I?
The process, yeah.
The process, yeah. So
how'd you bring people along?
Yeah. So, so I started in this position in 2019, and we've had a work group representing 11 agencies or 16 specific programs of DV providers, both housing providers and a handful of other culturally specific agencies. And we've been meeting twice a month for the last 18 months. I've also met with 10 or so additional DV programs and close community partners to get input. And so this is the group that's been coming together as a work group to plan out all of this. And I think that having key staff and consistent attendance and some of the existing relationships has really, we've been able to like leverage that to get these things done. One of the things that I've tried to be, and we've tried to be intentional with in our conversations, is the framing and centering of racial justice, and really being explicit that the system we're building is within these inherently racist institutions. It's the soup that we sit in, and if we can't dismantle it entirely, what at the very least can we do to mitigate it? So as a group, we looked at different tools, discussed how each program currently prioritized, and then a lot of imagining together of what else could be possible. We did work closely with mainstream coordinated entry folks, got input and consultation about this work, had relationships with folks throughout the mainstream homeless housing systems, and sought out and are seeking out still formal consultation on racial equity implications of the system. So
Wonderful. Lots of
that's,
cross-pollination.
yes.
And a real intensive process, real intensive, intentional. People really went to work. Yeah. Thanks so much, Leah.
Yeah.
What about in Clark County, Catherine? How did you move this process along and get buy-in?
So in Clark County, we did actually a huge charrette process at the very beginning of it, to be able to educate folks about this new process of coordinated entry, and to be able to then incorporate the participants and any other interested parties that we thought needed to be stakeholders and participants in the planning process of coordinated entry. We actually had them all become then kind of the different working groups to work through the various processes. We have a leadership group that still helps to continue to make decisions around coordinated entry and to deliberate around any issues that are occurring around coordinated entry. That still continues to meet monthly. Initially, that leadership group, as well as some of the working groups, were meeting like, it felt like almost constantly, like on a weekly basis when we were in the planning process. And we were also at the time working very closely with the VA, because we were also in the same, and it kind of a parallel effort around ending veteran homelessness. So we were working very closely on kind of trying to just build the process, all of the steps of it. How do clients engage with it? What is the messaging that clients receive about what happens when they get to an assessment site? There are all kind of pieces that came into play. How do we promote locations? How do we also make sure that the assessment is accessible not just to an office setting, but also, because we've built and strengthened coordinated outreach and street outreach over the last few years, that we made sure to also give those tools and access to that information to our outreach teams. So wherever someone is identified that is experiencing homelessness can also be assessed as well. So we underneath the leadership group, we and again through the charrette process, people identified and self-identified, volunteered to be part of the various working groups for the different subpopulations, and that's how we eventually kind of moved into making sure that the process was very comprehensive and also very open to all the various representatives of whether it was an agency that was representing a subpopulation of a certain type of sector of service, whether it was a certain type of you know, whether it was dealing with disabilities, whether it was dealing with access, age, all those kind of things, we took all of those into account into our different steps of our planning processes. So then that way, that also fed into how we created our tools, how we continue to look and re-look at our assessment information, and we continue to meet on a monthly process. So it's an ongoing um, process improvement that's occurring. One thing that's also a very important piece of our coordinated entry process is that our assessment tools are built into our homeless management information system. So if you know, and which makes it also accessible to all of the providers that are entering data, which is all of our homeless service providers in our community, actually. We also have our own standalone database for those that are serving domestic violence populations as well. But for all of our homeless service populations, they have that are becoming assessing agencies, they have access to the assessment tools inside of our homeless management information system. And that also creates the whole kind of workflow of them being able to refer people to our housing queue. And then we also have a matching process. So then our matchers can then see who's the next most vulnerable client and match them to the next available housing resource. So that is all done and continue to be monitored on a monthly basis through our coordinated entry services working group, which is actually an official working under our continuum of care governance. So we still have a continuum of care working group, or I'm sorry, a continuum of care board that meets every single month. Also the working groups underneath it, most of them meet every single month as well, which includes our coordinated entry working group. And then as needed, we would provide feedback and updates to our board of what are some of the big things that are happening in our processes. So for example, with the updated data standards that came out this past year, we did mass retraining of all of our assessors, and we had to change a little bit of how that process works inside of our HMIS system. So we, you know, made sure we informed all of our agencies that this was coming. This was always an ongoing conversation. And then we had our training team come in and do all of those trainings. And we 5 turned out to be virtual trainings because it happened during the time of COVID, you know, stay-at-home orders. So we kind of continued to do that and rolled out all of those processes that way. So it's continued process improvement with this, with our working group. And again, also always engaging the subpopulations as needed, as we need to kind of finitely tweak certain pieces of the process to make sure our subpopulations are being able to serve who they need to serve.
Wow, that sounds incredibly thorough. And, you know, you have a very big tent with lots of voices at the table. You've got feedback loops. You've got continuous assessment going on rather than looking back in 3 years to see how you did. Lots of really wonderful elements you've incorporated. Makes me tired just to hear about it.
And one thing I forgot to mention too, with our monthly working group as well, we're looking at data too. So our HMIS agency or vendor also is doing regular dashboarded data around how many assessments are completed, which assessment types are they, what are the ranges of where people are falling on those assessments, as well as looking at how our agencies responding to coordinated entries. So if are they accepting referrals, are they denying referrals, what are the circumstances for why those are happening. So we're looking at that information, and we're also incorporating some of that information into our continuum of care monitoring.
Wonderful. Thanks for adding that. And also the piece that about tying it into HMIS, because I think that's going to be a question for a lot of communities that are working towards doing something like this. Thank you, Catherine. Sarah, what's your process been like?
So I want to sort of say that, you know, we're looking at a statewide view, and I think one of the things that we need to acknowledge statewide is where the rubber hits the road. There are not enough resources. There's not enough resources for DV, and there's not enough resources for homeless folks. And when we look at a tool, the biggest challenge is understanding the type of housing in each community, because it doesn't matter if we have a prioritization tool that, whether it's a flow chart or it's a vulnerability index, there are certain restrictions on every type of housing. So for example, rapid rehousing may not be great for DV survivors. It may, but we need to know more than their safety. We need to know, do they have co-occurring significant mental health challenges? Do they have the ability to maintain employment? Is 3 months going to be sufficient for them to be able to become and stay safe? Or are we setting them up to have failures because we really are looking for someone to put them in an attempt, because we're all exhausted, to help with safety, where there might be someone who doesn't have a DV or SA component, who maybe simply has that one paycheck away from a job. So one of the things we're looking at is, before we start looking at what the tool is, we have to look at the restrictions of what housing we have available, so we get the right people in the right places, and thereby treat everyone with dignity and respect. Concurrent to that, we also have to train on trauma-informed care and implicit and explicit bias, because we will still be excluding people from the accessible housing if we continue to not understand how trauma affects folks and our own biases. So we are working sort of at the state level to name our housing, and then understand the limitations of that housing, which goes back to something Cris says, because we want to be able to advocate for unsolicited or unrestricted funding. Because a lot of the work we're going to do for DV and SA may not come out of, or not be able to come out of, because of the way each program in HUD or MSHTA, which is our state, works. We may have to look for other ways to support folks outside of federal funding or state funding. This has to be a piece, the coordinated entry has to be piece of the overall effort for DV and SA, as well as acknowledging and respecting our friends on the homeless side who are saying things to us like, we can't put that person, as terrible as the situation is, in something like rapid rehousing, because they also have co-occurring limitations to making that rent, and we know we can't get an extension after 3 months. So I think the biggest thing we need to do is sit down and map the resources, figure out what's missing, talk to our friends at NNEDV for lobbying towards the pieces that are missing for DV and SA, and then also concurrently try to minimize the harm of coordinated entry through trauma-informed care, intersectionality, and as well as recognizing the really hard work of the homeless folks, because of the differences that are allowed between VAWA and HMIS, there's become an artificial division between sort of us scrapping between what is really not enough resources, instead of working together to get as many people housed and work together to ask for those resources, for more of those resources to be made available. So that's sort of the biggest thing, and how we're doing that is a cross-collaborative work through both surveys, research, and analysis, and bringing sort of the biggest sort of interested wonks, because that's one of the things I am as a wonk, at the state, so we can name these things before we move forward to changing or defining any of the tools within Michigan.
Thanks, Sarah. You're getting a lot of amens in the chat. Mapping, know what your resources are and what their limitations are. Seems like a really key starting point. Where I knew this was going to happen, we're close to the end of the time for this panel today. I wanted to just flip it back to you, each of you, if you have just one brief tip for communities that are just starting this conversation, just from your lessons learned, one brief tip that you might want to share for other communities.
Oh, maybe we can go backwards because I'm unmuted, if that's okay, Cris?
Sure, yeah.
I would just say that, remember that we're all in this together. We're all trying really hard and we're exhausted. And the homeless folks working in homeless shelters are exhausted, and the folks in DV and SA, and that creates horizontal hostility and a scarcity model. And we have to look at this in a way that all rising tide lifts all boats. So work with the homeless folks and remember that we're trying to all do the same thing, which is help others in our community.
Thanks, Sarah.
I would say the
Catherine?
biggest tip, I would say the biggest tip really is to listen. I think what we have in our community is amazing group of experts that have been serving our community, have been part of our community, whether it's from the street outreach lens to the domestic violence service provider to the various types of homeless service providers, that we really, most importantly, have to listen to each other so we understand, and also listen to our clients and get feedback from them. So like with some of our tools, we've tested our tools with clients before we roll them out in mass. So listening to them, getting an understanding from them as well, and being able to incorporate how we move forward with implementation. Because again, we can't go through an assessment that's going to take 2 hours if that's going to exhaust our clients. So making sure we listen to each other, and fine tune things as we go, because we realize, it's not like this is the only way it has to be. We want to make sure we listen and make changes as needed to make sure that we're serving truly. In essence, the whole intent of coordinated entry is to serve our clients and to make services the most accessible that they can possibly be.
Thank you. Thank you. I think that I'm really glad you mentioned people with lived experience being a big part of what can help shape this. We didn't have a chance to go through that together, although many of you did mention the way that you tried to involve consumers, people with lived experience, and people who are most affected by homelessness and domestic and sexual violence. So Leah, let's hear from you. One tip that you might have before we move over to hearing from our SNAPS partners.
Got a couple of short ones, and I think this reflects what other folks have already said. Relationships are key. Cross systems relationships within your own system. None of this can work without strong collaborative relationships. Specifically for us, systems change work needs funding. Systems change work needs to be funded for it to happen. So, and I think lastly, looping back to the conversations around racial equity and centering racial justice again, because if knowing the disproportionate impact, if we are not serving Black, trans, Indigenous folks in our programs, what are we doing? So yeah.
Right. Thanks, Leah. I remember really keying into the phrasing that I saw in some of your paperwork, which was, who is the farthest from the resources? And I really loved that, the way that you captured that. All right, well, thank you. I know we could go on with this conversation for a whole lot longer, and maybe we'll find ways to extend it into future webinars, but I'm going to now pass the mic over to Lisa and Abby. Thank you all.
Thanks, Kris. Lisa and I are just going to briefly introduce ourselves and then just kind of make some closing remarks on all of this and weigh in from the HUD perspective. My name is Abby Miller. I use she or they pronouns, and I work for the SNAPS office as a senior specialist. Lisa, do you want to introduce yourself?
Yeah, hi everyone. I'm Lisa Kaufman. I'm also a staff person at HUD's Office of Special Needs Assistance Programs and use she and her pronouns.
To get us started, I want to just begin by thanking all of our partners that presented on this call and the panelists. And those of you who are participating, whether you work mainly on homelessness or primarily with survivors of violence, Sarah said it, it does not matter. This is incredibly complicated and incredibly important work on whatever corner of the work is yours. And we're all navigating a lot of relationships. Not all of our partners have goals that marry well with other partners' goals in this. And also we are across the board working with folks who have had most other institutions and personal supports utterly fail them. Everyone who comes to coordinated entry access points genuinely needs help. It may differ what that help looks like, but they need it. And it's overwhelming to work on the front lines. Frontline workers have decision fatigue. They're experiencing vicarious trauma from their work, and often, if not every single day, feel the weight of feeling that there is nothing to offer those folks who so obviously need help. And that is the reality that we're working in. I think what Lisa and I have to say today, it's not going to answer all of the questions about how to fix the situation. Some of it is out of our hands, and some of it we can do. But today, really, we want to lay out some principles and commitments that we're committed to supporting communities to nurture and grow in your coordinated entry process, and some considerations for the field as we explore and experiment with really necessary equitability improvements to coordinated entry. So I will pass it to you, Lisa, to talk about some of these principles.
Yeah. So definitely a lot of what Abby and we're going to say is really going to affirm what you heard from Sarah and Leah and Catherine, quite frankly. Just incredible work and creativity. So we just want to leave you all with some things to think about, particularly as you are looking at transforming your system to make it more responsive for everyone. And I think it was Dr. Cris that said earlier, right? If our system, if this response is safe for survivors, it's safe for everyone, right? It's safe for all homeless people. So definitely want to make sure that when you're looking at your systems, that it is person-centered, right? All of the panelists talked about that today. And by person-centered, right, we are saying to you all to make sure that you're approaching coordinated entry assessment in a more expansive and inclusive way, right? Leah mentioned, that we need to make sure that this resource works for survivors, right? Works for homeless people and not the other way around. This is not about being married to a specific tool or a process. It really is about what we can do to get marginalized people, to get homeless people connected to the housing and services that they need. So we definitely need to engage people who have lived experience, survivors, people who are experiencing homelessness, people who have experienced homelessness, right? We need to have them with us at the beginning in this entire sort of, thought partnering process. It's important. We have to have them be a part of owning the community response, right? What do we want to do different for our prioritization and assessment? It does none of us any good, right? To do these transformative systems and approaches and strategies, and we've not even brought in the expertise and the feedback of the folks who are accessing services. So if you all hear nothing else from me today, please hear that as you're thinking about, retooling your systems. Make sure that, survivors, people who are experiencing homelessness are there with you at the beginning with meaningful integration of their expertise, of their feedback, of their comments about your system. So definitely want to make sure that you rely on them to help shape your improvements. Also, Kris Billhardt talked about this principle as well, to be sort of flexible and equity oriented, right? Coordinated entry assessment and prioritization is only a part of the improvement equation. All of the panelists, many of you in the chat, right? We've been following the chat, talked about, this is all great, but how do I do this in communities where the affordable housing options are slim to none, right? How do we deal with, the scarcity of available housing, that we have to place people in? And I mean, that's important, right? Like, that is not a separate conversation. We need to have those conversations too when we're thinking about retooling our systems. And we have to make sure that we are developing resources that meet the needs of the people, right? We don't always have to go to the sort of big box landlords. If we are bringing in people with lived experience, we may get a whole other sort of pool of housing providers, landlords, small mom and pops that we never even thought of, right? They may need to be educated. Why would I want to get involved in this program? They may have all kinds of misinformation or misnomers about what housing assistance program looks like, but you're on the ground, you're their neighbors, you're their partners, you can kind of educate them about this resource in the community that is housing their neighbors, their friends, people they work with, people that they, attend faith services with, and everything else. So landlord engagement is important, right? Partnering with the other folks in your community that are doing housing, the tax credit providers and the affordable housing developers, and folks that are getting home dollars in your community, and CDBG. And I know I know you all have thought about all of this stuff before, but that's important, right? We have to make sure that there is a pool of diverse resources for survivors, for all homeless folks, right? People want options, and it's incumbent upon us to make sure that we're giving people as many options as we can. And we have to make sure that the rehousing strategies that we're using include, like I said, people who are experiencing homelessness, other housing and service providers, landlords, make sure that we're all coming together to marshal resources. And if you want more information about some strategies to include, I'll put some resources in the chat. Through the COVID-19, SNAPS has been doing a lot of technical assistance, and we've been publishing a lot of resources for communities, and we have published a number of rehousing strategies for specific populations, ways that you can get engaged with other housing providers in your community. So I'll definitely, in the interest of time, I won't talk specifically about that, but make sure that I will put that resource in the chat. And then lastly, of course, the principles for coordinated entry is that the system needs to be trauma informed, right? So kudos to Sarah and Catherine and Leah and all of you, quite frankly, the domestic violence and sexual assault field has really been the leader when we think about trauma informed services for homeless folks. Many of you are members of your COCs, and many of you have brought the notion of what trauma-informed care and services and responses looks like, and you've been the leaders in educating your COC about how to meaningfully and intentionally attaching those principles to your approach, to your response. So we definitely want to thank you all for that. Continue to encourage you to do that, and just let you know that we've heard you say that simply by us saying that something needs to be trauma informed is not specific enough, right? So we are also committed to providing more guidance, more examples about how to transform your coordinated entry process to be more trauma informed. We're also looking at additional resources to provide you with more examples and concrete information, including lifting up programs like the panelists talked about, combining with our friends and colleagues in the consortium and our larger TA pool that we have, right? Like that's something that we hear, and we are committed to walking alongside you all to provide some guidance and just practical information about what a trauma-informed approach will look like and where you can find resources to make sure that your programs are trauma-informed. So I'm going to turn it over to Abby right now.
Thank you, Lisa. I just wanted to highlight a few resources. I know our HUD exchange has turned into a bit of a mess during COVID. It's actually because we've been putting out a lot of resources, but it can be a little hard to find things. So wanted to make sure that you have these here. And this is really our response in the moment of the pandemic of both knowing that we have had historic disproportionality and disparities among Black, Indigenous, and people of color, among queer folks, among survivors. And we wanted to make sure that we are addressing them in this time when actually the moment called for changes. And so, sometimes it's easier when your barriers are down to make more changes. So we really wanted to be able to capitalize on the moment to press for more equitable practices in coordinated entry and throughout our homeless service systems. I will leave you with these and thank everybody again because we are running right up on time. But before we wrap up, I want to say SNAPS is committed to doing more work in this space. We understand that there are really concrete questions about how you do this. I heard questions about by name lists, about HMIS, and but if we do this, then how do we do that? I would say, let's not put the cart before the horse. What we want to do today is start thinking more expansively. And then we want to work with you all. We want to marshal our technical assistance and training and our partnerships with the folks on this call to make sure that we actually get concrete responses and answers to these sticky problems, because we know these are the things that hang you up. But don't let them hang you up today. I want to end on an expansive note because I think that's what our moment calls for. Thank you so much. I don't know if I'm turning it back to Heidi or Chris or somebody else.
Thank you, Abby and Lisa and all the panelists. I think this has been an extraordinary example of collaboration and systems change in the making. I think a theme that all the panelists shared was the tremendous importance of collaboration and the fact that we are not alone in these processes. These are complex things, and we need to rely on each other for shared solutions. You heard strategies that are different from place to place, but some of them had clear things in common. We heard about the importance of dismantling racial injustice. We heard about centering lives and the tremendous value of having people with lived experience be at the center of all of our strategies to end homelessness, to end violence. And we heard about understanding and seeing the whole person, no matter at what point of the process we encounter people. We invite you to reach out for support and technical assistance. We also understand that we never have enough time to go deeply into any of these things. So we will be putting out some options for deeper dives and collaborations in the next coming months. But in the meantime, please reach out to us at the Consortium for TA. You heard about a survey that we're putting out, and the link is on the screen there. We want to know what you're doing. And situations or examples of collaborations like today's, we're really looking for what alternatives are you implementing? What tools are you creating? What processes work for you? And what do you have in place along the lines of all these alternatives on the screen? So please reach out. Don't give up. We have a great opportunity to make a big change. And I'm very glad to see that we're part of these processes. With that, we're 2 minutes late. I want to express my gratitude again to all of you, to HUD for showing up with us today, and to everyone who's here. And have a great rest of the week. Thanks, everyone.